Certified Clinical Medical Assistant Practice Exam. Question 1. What federal agency requires the use of sharps containers? Here are the options. Option A. Occupational Safety and Health Administration. Option B. Drug Enforcement Agency. Option C. Department of Defense. Option D. Law Enforcement Agency. The correct answer is option A. Occupational Safety and Health Administration. The correct answer is Occupational Safety and Health Administration, OSHA. OSHA is a federal agency responsible for ensuring safe and healthy working conditions for employees in the United States. They require the use of sharps containers, which are specially designed containers used to safely dispose of sharp medical instruments such as needles and syringes. This requirement helps prevent injuries and the spread of infectious diseases in healthcare settings. Question 2. The medical assistant is responsible for correctly following OSHA guidelines for self-protection and the protection of other employees and patients. Here are the options. Option A. False. Option B. True. The correct answer is option B. True. The medical assistant is responsible for correctly following OSHA guidelines for self-protection and the protection of other employees and patients. This means that they must adhere to safety protocols and procedures to prevent the spread of infections and ensure a safe working environment for everyone involved. By following these guidelines, the medical assistant can minimize the risk of accidents, injuries, and the transmission of diseases. Question 3. Some clinical signs of head injury could be blank. Here are the options. Option A. Vomiting. Option B. Headache. Option C. All of these. Option D. Confusion. The correct answer is option C. All of these. The correct answer is all of these. This is because vomiting, headache, and confusion are all common clinical signs of head injury. Vomiting can occur due to increased pressure in the brain. Headache is a common symptom of head trauma, and confusion is often seen in individuals with head injuries. Therefore, all of these symptoms can be indicative of a head injury. Question 4. When preparing a file for a new patient, the medical assistant should. Here are the options. Option A. Be sure the patient's name is spelled correctly. Option B. Review the forms the patient filled out for completeness. Option C. Copy the insurance card or assure that insurance information is included. Option D. All of these. The correct answer is option D. All of these. The correct answer is all of these. When preparing a file for a new patient, the medical assistant should ensure that the patient's name is spelled correctly to avoid any confusion or errors in the future. They should also review the forms the patient filled out for completeness, making sure that all necessary information is provided. Additionally, they should copy the insurance card or ensure that insurance information is included in the file to facilitate billing and insurance claims. Question 5. The radial pulse is located in the blank. Here are the options. Option A. Wrist. Option B. Chest. Option C. Neck. Option D. Head. The correct answer is option A. Wrist. The radial pulse is located in the wrist. This is because the radial artery, which carries oxygenated blood from the heart to the hand, runs along the inside of the wrist. When checking the pulse, the radial artery is easily accessible and can be felt by placing 2 fingers, usually the index and middle fingers, on the inner side of the wrist, just below the base of the thumb. Question 6. The medical assistant's main responsibility is to help the physician provide patient care. Here are the options. Option A, false. Option B, true. The correct answer is option B, true. The medical assistant's main responsibility is to assist the physician in providing patient care. This includes tasks such as taking patient histories, measuring vital signs, preparing examination rooms, and assisting with medical procedures. By performing these tasks, the medical assistant plays a crucial role in ensuring that patients receive quality care and that the physician is able to focus on diagnosing and treating patients. Therefore, the statement, "The medical assistant's main responsibility is to help the physician provide patient care," is true. Question 7. Body temperature measured under the arm of a patient is called the blank temperature. Here are the options. Option A, oral. Option B, rectal. Option C, axillary. Option D, maxillary. The correct answer is option C, axillary. Axillary temperature refers to the body temperature measured under the arm of a patient. This method is commonly used when it is not feasible or practical to measure temperature orally or rectally. The axillary temperature is considered a less accurate measure compared to rectal or oral temperatures, as it may be influenced by environmental factors and may not accurately reflect the core body temperature. Nonetheless, it is a convenient and non-invasive method for obtaining a general indication of body temperature. Question 8. The normal adult heart rate is 60-100 bpm. Here are the options. Option A, true. Option B, false. The correct answer is option A, true. The normal adult heart rate is typically between 60 and 100 beats per minute (bpm). This range is considered normal for a healthy adult, and it can vary depending on factors such as age, fitness level, and overall health. Heart rates below or above this range may indicate underlying health conditions or the need for medical attention. Therefore, the statement that the normal adult heart rate is 60-100 bpm is true. Question 9. The blood pressure should not be taken on an arm if blank. Here are the options. Option A, the patient has had breast surgery on that side. Option B, on the arm with enrollment for infusion. Option C, on the arm with a cast. Option D, all of these. The correct answer is option D, all of these. The blood pressure should not be taken on an arm if the patient has had breast surgery on that side, as it could cause discomfort or damage to the surgical site. Similarly, it should not be taken on the arm with enrollment for infusion, as it could disrupt the flow of medication or fluids. Additionally, taking blood pressure on the arm with a cast may cause discomfort or interfere with the healing process. Therefore, all of the given answers are correct in stating situations where blood pressure should not be taken on an arm. Question 10. PO means here are the options. Option A, rectally. Option B, by mouth. Option C, sublingual. Option D, intravenous. The correct answer is option B, by mouth. The term PO is an abbreviation for PROS, which means by mouth in medical terminology. It indicates that a medication should be taken orally, usually in the form of a pill or liquid, and swallowed. This route of administration allows the medication to be absorbed through the gastrointestinal tract and enter the bloodstream. It is a common and convenient way to administer medications to patients. Question 11. Viruses, bacteria, fungi, and parasites are all agents in the chain of infection. Here are the options. Option A, true. Option B, false. The correct answer is option A, true. Viruses, bacteria, fungi, and parasites are all microorganisms that can cause infections in humans or other organisms. They are considered agents in the chain of infection because they can transmit and spread diseases from one host to another. Each of these microorganisms has different characteristics and mechanisms of infection, but they all play a role in the transmission and progression of infectious diseases. Therefore, the statement viruses, bacteria, fungi, and parasites are all agents in the chain of infection is true. Question 12. Persistent increased systolic and diastolic pressures are indicative of blank. Here are the options. Option A, hypertension. Option B, normal. Option C, no correct answer. Option D, hypertension. The correct answer is option D, hypertension. Persistent increased systolic and diastolic pressures are indicative of hypertension. Hypertension, also known as high blood pressure, is a condition where the force of blood against the artery walls is consistently too high. This can lead to various health problems, including heart disease, stroke, and kidney damage. Therefore, the correct answer is hypertension. Question 13. HIV means blank. Here are the options. Option A, hepatitis B virus. Option B, hepatitis C virus. Option C, human immunodeficiency virus. Option D, human infectious virus. The correct answer is option C, human immunodeficiency virus. HIV stands for human immunodeficiency virus. It is a virus that attacks the immune system, specifically targeting CD4 cells, which play a crucial role in fighting off infections. HIV weakens the immune system over time, leading to acquired immunodeficiency syndrome AIDS, a condition in which the body is unable to fight off infections and diseases. Question 14. Waveform refers to movement away from the isoelectric line, either upward, positive deflection, or downward, negative deflection. Here are the options. Option A, false. Option B, true. The correct answer is option B, true. The explanation for the given correct answers that a waveform does indeed refer to movement away from the isoelectric line, which can be either upward, positive deflection, or downward, negative deflection. This movement away from the isoelectric line is what creates the characteristic shape of a waveform in various physiological signals, such as electrocardiograms X or electroencephalograms EEGs. Therefore, the statement waveform refers to movement away from the isoelectric line, either upward positive deflection or downward negative deflection, is true. Question 15. The period of contractions of both atrial and ventricles is blank. Here are the options. Option A, diastole. Option B, arrhythmia. Option C, systole. Option D, repolarization. The correct answer is option C, systole. During the period of systole, both the atria and ventricles contract. This is the phase of the cardiac cycle where blood is pumped out of the heart. In contrast, diastole is the relaxation phase of the cardiac cycle where the heart muscles relax and fill with blood. Therefore, the correct answer is systole, as it refers to the contraction of both the atria and ventricles. Question 16. The medical assistant should collect which of the following when a new patient comes to the office? Here are the options. Option A, patient information sheet. Option B, copy of insurance card front and back. Option C, copy of driver's license. Option D, all of these. The correct answer is option D, all of these. When a new patient comes to the office, it is important for the medical assistant to collect all of the mentioned items. The patient information sheet provides essential details about the patient's medical history, contact information, and any allergies or previous illnesses. The copy of the insurance card, front and back, is necessary to verify the patient's insurance coverage and to ensure accurate billing. Lastly, the copy of the driver's license helps in confirming the patient's identity and maintaining accurate records. Collecting all of these items ensures that the necessary information is available for the patient's medical records and for administrative purposes. Question 17. Healthcare information is used to. Here are the options. Option A, all of these. Option B, determine how many patients enter a facility with the same diagnosis. Option C, decide what equipment is needed to meet the needs of the patient population. Option D, help the facility plan for the needs of next week and next year. The correct answer is option A, all of these. Healthcare information is used in various ways to improve patient care and facility planning. By determining the number of patients entering a facility with the same diagnosis, healthcare providers can identify trends and patterns to better allocate resources and provide targeted treatment. This information also helps in deciding what equipment is needed to meet the needs of the patient population, ensuring that the facility is well equipped to provide effective care. Additionally, healthcare information aids in planning for the future by analyzing current data to anticipate the needs of next week and next year. Therefore, the correct answer is all of these. Question 18. Blood from all individuals should be considered blank. Here are the options. Option A, decontaminated. Option B, biodegradable. Option C, chemically hazardous. Option D, infective or infectious. The correct answer is option D, effective or infectious. Blood from all individuals should be considered infective or infectious because blood can carry various pathogens such as bacteria, viruses, and parasites that can cause infections in other individuals if proper precautions are not taken. Therefore, it is important to handle and dispose of blood safely to prevent the spread of infectious diseases. Question 19. Taking the patient's temperature with an ear thermometer is known as the blank. Here are the options. Option A, axillary. Option B, tympanic. Option C, rectal. Option D, oral. The correct answer is option B, tympanic. The correct answer is tympanic because taking the patient's temperature with an ear thermometer is commonly known as tympanic temperature measurement. This method involves inserting the thermometer probe into the ear canal to measure the temperature of the tympanic membrane. It is a quick and non-invasive way to obtain an accurate temperature reading. Question 20. An instrument called a centrifuge blank. Here are the options. Option A, freezes specimens. Option B, heats specimens. Option C, separates the cellular and liquid portions of the blood. Option D, is used for incubation. The correct answer is option C, separates the cellular and liquid portions of the blood. A centrifuge is a laboratory instrument used to separate the cellular and liquid portions of the blood. It works by spinning the blood at high speeds, causing the heavier cellular components to settle at the bottom of the tube while the lighter liquid portion rises to the top. This separation allows for further analysis and testing of the blood components, such as isolating specific cells or measuring the concentration of certain substances. Question 21. Tuberculosis in its active phase is what type of precaution? Here are the options. Option A, airborne precaution. Option B, standard precaution. Option C, contact precaution. Option D, universal precaution. The correct answer is option A, airborne precaution. Tuberculosis in its active phase is categorized as an airborne precaution. This means that the disease is transmitted through the air when an infected individual coughs, sneezes, or talks. Airborne precautions are necessary to prevent the spread of infectious agents that can remain suspended in the air for long periods of time. These precautions typically include the use of respiratory protection, such as masks, and the implementation of proper ventilation systems to reduce the risk of transmission. Question 22. Why should a patient who is in shock be positioned with the head lower than the rest of the body? Here are the options. Option A, to prevent vomiting. Option B, to encourage blood flow to the brain. Option C, to make the heart beat slower. Option D, to reduce oxygen use. The correct answer is option B, to encourage blood flow to the brain. Positioning a patient who is in shock with the head lower than the rest of the body helps to encourage blood flow to the brain. In shock, the body's blood pressure drops significantly, and blood flow to vital organs, including the brain, is compromised. By lowering the head, gravity assists in increasing blood flow to the brain, ensuring that it receives an adequate supply of oxygen and nutrients. This can help prevent further complications and improve the patient's condition. Question 23. What is the most important means of preventing the spread of infection? Here are the options. Option A, dry heat sterilization. Option B, bleach/water sanitation. Option C, hand washing. Option D, routine antibiotics. The correct answer is option C, hand washing. Hand washing is the most important means of preventing the spread of infection because it helps to remove dirt, germs, and bacteria from our hands. Regular hand washing with soap and water for at least 20 seconds can effectively kill and remove harmful pathogens, reducing the risk of transmitting infections to others. It is a simple and cost-effective method that can be practiced by anyone, anywhere, making it an essential practice in maintaining personal and public hygiene. Question 24. What is considered a normal adult pulse rate? Here are the options. Option A, 70-170. Option B, 90-130. Option C, 70-80. Option D, 60-100. The correct answer is option D, 60-100. A normal adult pulse rate refers to the average number of times the heart beats per minute in a resting state. The range of 60-100 is considered normal because it encompasses the typical pulse rates for most healthy adults. Pulse rates below 60 or above 100 may indicate an underlying health condition or physiological changes, such as cardiovascular problems or dehydration. Monitoring pulse rate can help assess overall cardiovascular health and detect any abnormalities. Question 25. For which of the following symptoms can the medical assistant offer advice over the telephone? Here are the options. Option A, none of these. Option B, nausea of 2 days duration. Option C, diarrhea that appears to be getting more frequent. Option D, pain in the arms with shortness of breath. The correct answer is option A, none of these. The medical assistant should offer advice over the telephone for none of the above symptoms. Nausea, diarrhea, shortness of breath, and sore throat can all be indicators of potentially serious underlying conditions. Offering advice over the phone without a proper medical evaluation could be dangerous. It's crucial to encourage the patient to seek in-person medical attention to receive an accurate diagnosis and appropriate treatment. Question 26. Listening to the sounds produced while tapping the patient with fingers is called blank. Here are the options. Option A, audition. Option B, auditive. Option C, percussion. Option D, propitiation. The correct answer is option C, percussion. Percussion is the correct answer because it refers to the act of tapping or striking the body to produce sounds that can help in diagnosing certain medical conditions. This technique is commonly used by healthcare professionals to assess the density and location of organs, detect fluid accumulation, and evaluate the presence of abnormal masses in the body. Audition, auditive, and propitiation are not relevant terms in this context. Question 27. A disease state that results from the invasion and growth of microorganisms in the body is. Here are the options. Option A, a syndrome. Option B, an infection. Option C, a laceration. Option D, an asepsis. The correct answer is option B, an infection. An infection is the correct answer because it refers to a disease state caused by the invasion and proliferation of microorganisms in the body. This invasion and growth of microorganisms can lead to various symptoms and health complications. Infections can be caused by bacteria, viruses, fungi, or parasites, and can affect different parts of the body. Proper diagnosis and treatment are essential to manage and control infections. Question 28, which is recorded as the systolic blood pressure. Here are the options. Option A, the point where the last sound is heard. Option B, anything under 100 on the sphygmomanometer. Option C, anything over 100 on the sphygmomanometer. Option D, the point where the first sound is heard. The correct answer is option D, the point where the first sound is heard. The systolic blood pressure is recorded as the point where the first sound is heard. This is because the first sound, known as chorate cough sound, is produced when the pressure in the cuff is released and blood starts flowing through the artery again. The systolic pressure represents the maximum pressure exerted on the arterial walls during a heartbeat, and it is typically higher than the diastolic pressure, which is recorded as the point where the last sound is heard. Question 29. Performing only those procedures that a medical assistant is trained to do and allowed to do by law is said to be. Here are the options. Option A, working within the scope of practice. Option B, doing the job. Option C, being appropriate. Option D, restrained. The correct answer is option A, working within the scope of practice. Performing only those procedures that a medical assistant is trained to do and allowed to do by law is said to be working within the scope of practice. This means staying within the boundaries of their professional training skills and legal authorization. It ensures patient safety and maintains professional standards. While the other options might have some relevance, they don't accurately describe this concept. Question 30. Proteinuria. Here are the options. Option A, the presence of excess iron in the urine. Option B, blood in the urine. Option C, sugar in urine. Option D, the presence of excess proteins in urine. The correct answer is option D, the presence of excess proteins in urine. Proteinuria refers to the presence of excess proteins in the urine. This condition occurs when the kidneys are unable to properly filter and retain proteins, causing them to leak into the urine. It can be a sign of kidney damage or dysfunction. Detecting proteinuria is important as it can indicate various underlying health conditions such as kidney disease, diabetes, hypertension, or urinary tract infections. Therefore, the correct answer is the presence of excess proteins in urine. Question 31. Which is not a vital sign of bodily function? Here are the options. Option A, temperature. Option B, weight. Option C, pulse. Option D, respiration. The correct answer is option B, weight. Weight is not considered a vital sign of bodily function because it does not directly reflect the functioning of essential physiological processes. Vital signs are measurable indicators of basic bodily functions that are necessary to sustain life, such as temperature, pulse, and respiration. Weight, on the other hand, is influenced by various factors including body composition, muscle mass, and fluid retention, and does not provide immediate information about the overall health or functioning of the body. Question 32. The portal of exit in the chain of infection is the method that an agent leaves its reservoir. Here are the options. Option A, true. Option B, false. The correct answer is option A, true. The statement is true because the portal of exit is the route through which a pathogen leaves its reservoir host. This can occur through various methods such as respiratory droplets, feces, urine, blood, or other bodily fluids. Understanding the portal of exit is important in preventing the spread of infectious diseases, as it helps identify the modes of transmission and implement appropriate control measures. Question 33. Who creates the rules and regulations to minimize workplace hazards? Here are the options. Option A, CLSI. Option B, CDC. Option C, OSHA. Option D, FDA. The correct answer is option C, OSHA. OSHA, or the Occupational Safety and Health Administration, creates the rules and regulations to minimize workplace hazards. OSHA is a regulatory agency within the United States Department of Labor, and its main goal is to ensure safe and healthy working conditions for employees. They establish and enforce standards, conduct inspections, provide training, and promote awareness of workplace safety. By creating and implementing these rules and regulations, OSHA aims to reduce the number of workplace accidents and injuries, protecting workers and promoting a safe working environment. Question 34. Which of the following should be included in a section of the Office Policy Manual? Here are the options. Option A, employee evaluations. Option B, all of these. Option C, confidentiality. Option D, tardiness and absenteeism. The correct answer is option B, all of these. All of the options listed, including employee evaluations, confidentiality, and tardiness and absenteeism, should be included in a section of the Office Policy Manual. Employee evaluations are important for tracking performance and providing feedback. Confidentiality ensures that sensitive information is protected, and guidelines regarding tardiness and absenteeism help establish expectations for attendance and punctuality. Including all of these topics in the manual helps to provide employees with clear guidelines and expectations for their behavior and performance in the workplace. Question 35. An apical pulse is the method of choice for blank. Here are the options. Option A, children over 4 years old. Option B, adolescents. Option C, infants and young children. Option D, young adults 20-40. The correct answer is option C, infants and young children. An apical pulse is the method of choice for infants and young children because their heartbeats are best heard at the apex of the heart, which is located on the left side of the chest. This method involves using a stethoscope to listen to the heart sounds directly over this area, allowing for a more accurate assessment of the heart rate and rhythm in this age group. In older children, adolescents, and young adults, the radial pulse located on the wrist is typically used as it is easier to access and provides a reliable measure of heart rate. Question 36. As a medical assistant, you are responsible for clarifying for patients what you are permitted to do. Here are the options. Option A, true. Option B, false. The correct answer is option A, true. As a medical assistant, it is indeed your responsibility to communicate clearly with patients about the tasks and responsibilities you are authorized to perform. This helps to establish trust and understanding between the medical assistant and the patient, ensuring that the patient has accurate information about the medical assistant's role and abilities. By clarifying what you are permitted to do, you can also help manage patient expectations and avoid any misunderstandings or potential harm. Question 37. The first line of defense in preventing disease is blank. Here are the options. Option A, wearing a mask. Option B, wearing gloves. Option C, wearing a gown. Option D, the medical hand wash. The correct answer is option D, the medical hand wash. The first line of defense in preventing disease is the medical hand wash. Hand washing is a simple and effective way to remove germs and prevent the spread of infections. It helps to eliminate bacteria and viruses that may be present on our hands, reducing the risk of transmission through touch or contact with contaminated surfaces. Regular and thorough hand washing with soap and water for at least 20 seconds is recommended by health experts as a crucial step in maintaining good personal hygiene and preventing the spread of diseases. Question 38. Fifth order of draw. Here are the options. Option A, serum or non-additive tube red or red/gray. Option B, sodium citrate tubes light blue. Option C, edge tubes lavender. Option D, heparin tubes green. The correct answer is option C, edge tubes lavender. The fifth order of draw and phlebotomy refers to the order in which blood samples are collected to minimize the risk of cross-contamination. The correct answer, edge tubes lavender, indicates that these tubes should be drawn after the serum or non-additive tubes red or red/gray and before the sodium citrate tubes LT blue. Edge tubes are used for tests that require whole blood or plasma, as edge is an anticoagulant that prevents blood from clotting. This order ensures that the edge tubes are not contaminated with any additives from the previous tubes. Question 39. Which of the following is not part of the patient's medical record? Here are the options. Option A, dates and findings of office visits. Option B, financial records pertaining to the patient. Option C, correspondence from other doctors concerning the patient. Option D, laboratory and X-ray reports. The correct answer is option B, financial records pertaining to the patient. Financial records pertaining to the patient are not typically included in the patient's medical record. The medical record focuses on clinical information like health history, doctor's notes, lab results, and correspondence related to the patient's health. while financial information is usually kept separate for privacy and accounting purposes. Question 40. What is the relaxation period of the heart called? Here are the options. Option A, systole. Option B, repolarization. Option C, arrhythmia. Option D, diastole. The correct answer is option D, diastole. The relaxation period of the heart is called diastole. During diastole, the heart muscles relax and the chambers fill with blood. This allows for the heart to rest and refill with oxygenated blood before the next contraction. Systole, on the other hand, is the contraction phase of the heart where blood is pumped out of the chambers. Question 41. Which of the following items are parts of the physician's office budget? Here are the options. Option A, all of these. Option B, medical equipment. Option C, rent or mortgage. Option D, taxes. The correct answer is option A, all of these. All of the given options are parts of the physician's office budget. Medical equipment, rent or mortgage, and taxes are all expenses that a physician's office would need to budget for. Medical equipment includes a cost of purchasing or leasing necessary equipment for the office. Rent or mortgage refers to the cost of the office space, whether it is rented or owned. Taxes are a necessary expense that the office would need to pay, such as property taxes or income taxes. Therefore, all of these items are part of the physician's office budget. Question 42. The blood lancet is used for the collection of blood specimens by blank. Here are the options. Option A, injection. Option B, suction. Option C, cutting. Option D, skin puncture. The correct answer is option D, skin puncture. The blood lancet is a small, sharp instrument used to puncture the skin for the collection of blood specimens. It is not used for injection or suction, as those methods involve different tools and purposes. Cutting is also not the correct answer, as the lancet is not meant to cut through the skin but rather create a small puncture. Therefore, the correct answer is skin puncture. Question 43. Sixth order of drawer. Here are the options. Option A, blood cultures yellow. Option B, oxalate/fluoride tubes gray. Option C, serum or non-additive tube red or red/gray. Option D, edge tubes lavender. The correct answer is option B, oxalate/fluoride tubes gray. The correct answer is oxalate/fluoride tubes gray. In the sixth order of drawer, after collecting blood cultures yellow and serum or non-additive tubes red or red/gray, the next tubes to be drawn are the oxalate/fluoride tubes gray. These tubes are used for collecting samples for glucose testing and preserving the blood sample for accurate glucose measurement. The gray top indicates the presence of an anticoagulant oxalate and a preservative fluoride in the tube, which helps prevent the breakdown of glucose in the sample. Question 44. This type of disinfection is the only type that kills all microbial life including spores. Here are the options. Option A, disinfection. Option B, bleach 110. Option C, autoclaving. Option D, sanitizing. The correct answer is option C, autoclaving. Autoclaving is the correct answer because it is a type of disinfection method that uses high pressure and steam to kill all microbial life, including spores. The high temperature and pressure in an autoclave effectively destroy the DNA and proteins of microorganisms, making it an extremely effective method for sterilization. Autoclaving is commonly used in medical and laboratory settings to ensure that all equipment and instruments are free from any viable microorganisms. Question 45. The radial artery is located. Here are the options. Option A, on the thumb side of the wrist. Option B, on the pinky side of the wrist. Option C, on the right side of the neck. Option D, on the left side of the neck. The correct answer is option A, on the thumb side of the wrist. The radial artery is located on the thumb side of the wrist. This artery is one of the major blood vessels in the arm and is responsible for supplying oxygenated blood to the hand and fingers. It can be easily felt by placing 2 fingers on the inner wrist, just below the base of the thumb. The radial artery is commonly used for taking a pulse and for procedures such as arterial blood gas sampling. Question 46. The temporary complete absence of breathing which may be a result of a reduction in the stimuli to the respiratory centers of the brain. Here are the options. Option A, tachypnea. Option B, apnea. Option C, brachypnea. Option D, dyspnea. The correct answer is option B, apnea. Apnea is the temporary complete absence of breathing. This can occur when there is a reduction in the stimuli to the respiratory centers of the brain, leading to a pause in breathing. It is characterized by the cessation of airflow and can be caused by various factors such as sleep apnea, respiratory depression, or neurological disorders. During an episode of apnea, the individual may experience a lack of oxygen, leading to symptoms like gasping or choking. Treatment options for apnea depend on the underlying cause and may include lifestyle changes, medication, or the use of a continuous positive airway pressure CPAP machine. Question 47. The most accurate and reliable measurement of body temperature is blank. Here are the options. Option A, oral. Option B, axillary. Option C, rectal. Option D, nasal. The correct answer is option C, rectal. The rectal temperature measurement is considered the most accurate and reliable method for determining body temperature. This is because the rectal thermometer is inserted into the rectum, which is closer to the body's core and provides a more accurate reflection of internal body temperature. Other methods like oral axillary and nasal measurements may be affected by external factors, such as breathing, eating, or environmental conditions, which can lead to less accurate readings. Question 48. Arrange these names in alphabetic order. Scroll down to view names. Select the sequence of the numbers that reflects the correct alphabetic order. 1 Woods Jones, Stephanie 2 Ross, Kim 3 Mitchell, Pat 4 Jones, Sandra. Here are the options. Option A, 1 2 3 4. Option B, 3 2 4 1. Option C, 2 3 1 4. Option D, 4 3, 2, 1. The correct answer is option D. 4, 3, 2, 1. The correct alphabetical order is 4, 3, 2, 1, which means Jones, Sandra Mitchell, Pat Ross, Kim Woods Jones, Stephanie. This order is determined by looking at the last names. First J comes before M and R, and W comes last. When last names are the same, like with Jones, we then alphabetize by first name. S comes before St. Question 49. Arrange these names in alphabetic order. Scroll down to view names. Select the sequence of the numbers that reflects the correct alphabetic order. 1 Morton, Diane. 2 Marsh, Danielle. 3 McDouglas, Dillard. 4 MacDouglars, David. Here are the options. Option A, 4, 2, 3, 1. Option B, 1, 2, 3, 4. Option C, 3, 2, 4, 1. Option D, 2, 3, 1, 4. The correct answer is option A, 4, 2, 3, 1. The correct alphabetical order is MacDouglas, David, Marsh, Danielle, McDouglas, Dillard, and Morton, Diane. This sequence places the surnames in order by comparing the letters from left to right. Question 50. When taking blood pressure, the deflation rate is. Here are the options. Option A, 1-2 mmHg. Option B, 0-1 mmHg. Option C, 2-3 mmHg. Option D, 4-5 mmHg. The correct answer is option C, 2-3 mmHg. The deflation rate when taking blood pressure refers to the rate at which the pressure is released from the cuff. A deflation rate of 2-3 mmHg means that the pressure is released at a rate of 2-3 millimeters of mercury per second. This rate allows for a gradual and controlled decrease in pressure, ensuring accurate readings. A slower deflation rate may lead to falsely high readings, while a faster rate may result in falsely low readings. Therefore, a deflation rate of 2-3 mmHg is considered optimal for obtaining accurate blood pressure measurements. Question 51. When the physician feels with fingers or hands to determine the physical characteristics of tissues or organs, it is called blank. Here are the options. Option A, auscultation. Option B, palpation. Option C, percussion. Option D, measuring. The correct answer is option B, palpation. Palpation refers to the act of using fingers or hands to feel and examine the physical characteristics of tissues or organs. It is a common technique used by physicians to assess the texture, size, consistency, and tenderness of various body parts. Through palpation, doctors can gather important information about the health and condition of the patient. Auscultation involves listening to internal sounds. Percussion is the act of tapping the body to produce sounds, and measuring refers to quantifying or determining the size or amount of something. Question 52. Which of the following locations is usually used for taking a pulse? Here are the options. Option A, apical pulse. Option B, brachial pulse. Option C, apical radial pulse. Option D, radial pulse. The correct answer is option D, radial pulse. The radial pulse is usually used for taking a pulse. The radial artery is located on the wrist, on the thumb side. It is easily accessible and provides an accurate representation of the heart rate. The pulse is typically taken by placing 2 fingers, usually the index and middle finger, on the radial artery and gently pressing to feel the pulsations. This method is commonly used in clinical settings and is a quick and convenient way to assess a person's heart rate. Question 53. A person who is not an established patient walks into the doctor's office asking to be seen. The medical assistant should. Here are the options. Option A. Determine that the patient is not in an emergency condition and then offer the person the first available appointment. Option B. Give the person an appointment at the earliest possible time. Option C. Tell the doctor. Option D. Fit the person in that day. The correct answer is option A. Determine that the patient is not in an emergency condition and then offer the person the first available appointment. Determine that the patient is not in an emergency condition and then offer the person the first available appointment. Rationale: the initial step in screening for appointments is to determine the urgency of the patient's condition. When an emergency does not exist, the first available appointment is offered. Question 54. A surgical stitch made to close a wound. Here are the options. Option A. Ligature. Option B. Incision. Option C. Dressing. Option D. Suture. The correct answer is option D. Suture. A suture is a type of surgical stitch that is used to close a wound. It is typically made using a thread or material that is strong enough to hold the wound together until it heals. Sutures are commonly used in various medical procedures, such as surgeries, to ensure proper healing and reduce the risk of infection. Question 55. The Good Samaritan law encourages healthcare professionals to adhere are the options. Option A. Report abuse to the proper authorities. Option B. Provide medical care within the scope of their training at the scene of an accident without fear of being sued. Option C. Provide for medical care to the elderly and poor. Option D. Provide for legal representation for all health care providers within a charity care-based hospital. The correct answer is option B. Provide medical care within the scope of their training at the scene of an accident without fear of being sued. The Good Samaritan law encourages healthcare professionals to provide medical care within the scope of their training at the scene of an accident without fear of being sued for negligence. This law aims to protect healthcare professionals who voluntarily assist in emergency situations from legal liability, allowing them to provide immediate medical assistance without hesitation. It promotes the idea that individuals should not be discouraged from helping others in need due to potential legal consequences, ensuring that prompt and necessary medical care can be provided in emergency situations. Question 56. A respiration rate of greater than 40/min. It is transient in the newborn and may be caused by the hysteria in the adult. Here are the options. Option A. Bradypnea. Option B. Apnea. Option C. Tachypnea. Option D. Dyspnea. The correct answer is option C. Tachypnea. Tachypnea is a condition characterized by a rapid breathing rate, typically greater than 40 breaths per minute. It is commonly seen in newborns and can be transient, meaning it resolves on its own. In adults, tachypnea can be caused by factors such as anxiety or hysteria. Therefore, tachypnea is the correct answer in this scenario. Question 57. To show empathy, the medical assistant could. Here are the options. Option A. Acknowledge the patient's feelings. Option B. Express sympathy for the patient's problems. Option C. Tell the patient about his or her own problems. Option D. Make no comment. It is none of the medical assistant's business. The correct answer is option A. Acknowledge the patient's feelings. To show empathy, the medical assistant could acknowledge the patient's feelings. Empathy involves understanding and sharing the feelings of another person, and acknowledging their emotions is a key way to demonstrate that understanding. While expressing sympathy can be part of empathy, it's not the core of it. The other options are not appropriate ways to show empathy. Question 58. The physician uses which of the following to examine the patient's eye? Here are the options. Option A. Percussion hammer. Option B. Ophthalmoscope. Option C. Tonometer. Option D. Otoscope. The correct answer is option B. Ophthalmoscope. The physician uses an ophthalmoscope to examine the patient's eye. An ophthalmoscope is a specialized instrument that allows the doctor to view the internal structures of the eye, including the retina, optic nerve, and blood vessels. It consists of a light source and a set of lenses that magnify and illuminate the eye. By using an ophthalmoscope, the physician can assess the health of the eye and detect any abnormalities or conditions that may be present. Question 59. After they are used, disposable syringes and needles, scalpel blades, and other sharp items should be placed in blank containers for disposal. Here are the options. Option A. Biodegradable. Option B. Kosher. Option C. Puncture resistant. Option D. Sanitized. The correct answer is option C. Puncture resistant. After they are used, disposable syringes and needles, scalpel blades, and other sharp items should be placed in puncture-resistant containers for disposal. This is because these items can cause injuries if not properly contained and disposed of. Puncture-resistant containers are designed to prevent accidental needle sticks and protect healthcare workers and waste management personnel from potential harm. By using puncture-resistant containers, the risk of transmitting infections and diseases through contaminated sharp items is minimized, ensuring the safety of everyone involved in the disposal process. Question 60. Third order drawer. Here are the options. Option A. Blood cultures yellow. Option B. Oxalate/fluoride tubes gray. Option C. Editor tubes lavender. Option D. Serum or non-additive tube red or red/gray. The correct answer is option D. Serum or non-additive tube red or red/gray. The correct answer is the serum or non-additive tube red or red/gray because blood cultures are collected in yellow tubes and oxalate/fluoride tubes are used for glucose testing. Therefore, the only option left is the serum or non-additive tube for general laboratory tests. Question 61. The proper way to dispose of a needle is to here are the options. Option A. Put it into a sharps container without recapping immediately after withdrawing it. Option B. Recap it and put it in sharps container. Option C. Throw it recapped into a biohazard bag. Option D. Collect them in a cup for disposal at the end of the day. The correct answer is option A. Put it into a sharps container without recapping immediately after withdrawing it. The proper way to dispose of a needle is to put it into a sharps container without recapping immediately after withdrawing it. This is the safest method as it reduces the risk of accidental needle stick injuries. Recapping the needle increases the chances of getting injured. Collecting them in a cup for disposal at the end of the day is not recommended as it poses a risk of needle stick injuries during the day. Question 62. Documents stored in the medical record. Here are the options. Option A. Are stored in the order in which they are received in the office. Option B. Have the oldest date first. Option C. Or store in reverse chronological order most recent first. Option D. Are stored in random order. The correct answer is option C. Are stored in reverse chronological order most recent first. Documents stored in the medical record are stored in reverse chronological order most recent first. This means the newest information is at the top of the file, allowing healthcare providers to quickly access the most current information about the patient's health status and treatment. Question 63. Standard precautions assumes all patients are here are the options. Option A. Sick. Option B. Infected for bloodborne pathogens. Option C. Virally infected. Option D. Healthy. The correct answer is option B. Infected for bloodborne pathogens. Standard precautions in healthcare assume that all patients may be infected for blood-borne pathogens such as HIV, HBV, and HCV. This approach involves using protective measures to minimize the risk of exposure to blood and other body fluids, ensuring safety for both healthcare providers and patients. Question 64. A respiratory rate greater than 24 per minute is called blank. Here are the options. Option A. Apnea. Option B. Hyperventilation. Option C. Bradypnea. Option D. Tachypnea. The correct answer is option D. Tachypnea. Tachypnea is the correct answer because it refers to a respiratory rate greater than 24 breaths per minute. Apnea refers to the absence of breathing, hypoventilation refers to inadequate breathing, and bradypnea refers to a respiratory rate less than 12 breaths per minute. Question 65. The medical record should be released only with A. Here are the options. Option A. Written release from the patient. Option B. Verbal order from the physician. Option C. Written order from the physician. Option D. Verbal order from the office manager. The correct answer is option A. Written release from the patient. In order to release a medical record, it is important to obtain written consent from the patient. This ensures that the patient has given their explicit permission for their medical information to be shared. Verbal orders from the physician or office manager are not sufficient as they can easily be misunderstood or misinterpreted. A written order from the physician may be required for certain specific situations, but the general rule is to obtain a written release from the patient. Question 66. The first positive deflection produced by ventricular polarization is the blank wave. Here are the options. Option A, Q wave. Option B, S wave. Option C, P wave. Option D, R wave. The correct answer is option D, R wave. The first positive deflection produced by ventricular polarization is the R wave. This is because the R wave represents the depolarization of the ventricles, specifically the contraction of the main pumping chambers of the heart. It is the largest and most prominent wave in a normal electrocardiogram (ECG) and indicates the beginning of ventricular systole, or the contraction phase of the cardiac cycle. Question 67. Polyuria. Here are the options. Option A, excess retention of fluids. Option B, the passage of large volumes of urine. Option C, water weight gain. Option D, painful urination. The correct answer is option B, the passage of large volumes of urine. Polyuria refers to the condition where a person passes abnormally large volumes of urine. This can occur due to various reasons such as increased fluid intake, diabetes, or kidney disorders. The excess production of urine can lead to frequent urination and an increased need to empty the bladder. Therefore, the given answer accurately describes polyuria as the passage of large volumes of urine. Question 68. Which of the following practices can reduce the risk of injury to healthcare staff and patients? Here are the options. Option A, using needles more frequently. Option B, getting less rest between shifts. Option C, practicing correct disposal of sharps and other hazardous waste and double gloving. Option D, using uncertified laundry processing facilities. The correct answer is option C, practicing correct disposal of sharps and other hazardous waste and double gloving. The correct disposal of sharps and other hazardous waste is crucial in a healthcare setting to prevent injuries and infections. Additionally, the practice of double gloving can further reduce the risk of injury, providing an extra layer of protection for both staff and patients. This is especially important given the decline in the use of needles. These practices help ensure the safety and well-being of both healthcare workers and patients. Question 69. What is the ratio of bleach to water recommended for disinfection? Here are the options. Option A, 1:10. Option B, 1:1. Option C, 1:5. Option D, 3:5. The correct answer is option A, 1:10. The recommended ratio of bleach to water for disinfection is 1:10. This means that for every part of bleach, 10 parts of water should be used. This ratio is commonly advised for disinfecting surfaces and objects to ensure effective killing of germs and bacteria. Using a higher concentration of bleach can be harmful, while using a lower concentration may not effectively disinfect. Therefore, the ratio of 1:10 strikes a balance between effectiveness and safety. Question 70. The primary purpose is to provide reliable data about a patient's health status by ensuring the accuracy of a test while detecting and eliminating errors. Here are the options. Option A, HIPAA. Option B, quality control. Option C, OSHA. Option D, clear. The correct answer is option B, quality control. Quality control is the process of ensuring the accuracy and reliability of a test by detecting and eliminating errors. It is essential in providing reliable data about a patient's health status. Quality control measures involve monitoring and evaluating the entire testing process, including equipment, reagents, and personnel, to ensure that the results obtained are accurate and consistent. By implementing quality control measures, healthcare professionals can have confidence in the test results and make informed decisions regarding patient care. Question 71. Which needle gauges are most commonly used for venipuncture? Here are the options. Option A, 24-25. Option B, 19-20. Option C, 21-22. Option D, 16-18. The correct answer is option C, 21-22. The most commonly used needle gauges for venipuncture are 21-22. These gauges are preferred because they strike a balance between being large enough to allow for a smooth blood flow and small enough to minimize patient discomfort. A larger gauge needle may cause more pain and bruising, while a smaller gauge needle may result in slower blood flow and clotting. Therefore, healthcare professionals often opt for 21-22 gauge needles for venipuncture procedures. Question 72. Words preceding a root word to put before. Here are the options. Option A, suffix. Option B, root. Option C, combining form. Option D, prefix. The correct answer is option D, prefix. The word you're looking for is prefix. A prefix is a group of letters or a word element that is added to the beginning of a root word to change its meaning or create a new word. Prefixes are commonly used in language to modify or enhance the meaning of words. For example, in the word precede, pre is the prefix, and it means before. So, precede means to go before, to come before. Question 73. The right side of the heart pumps blank blood. Here are the options. Option A, deoxygenated. Option B, oxygenated. Option C, none of these three. Option D, none of these four. The correct answer is option A, deoxygenated. The right side of the heart pumps deoxygenated blood. This is because the right atrium receives blood from the body that has already been used by the tissues and is low in oxygen. This deoxygenated blood is then pumped into the right ventricle, which contracts and sends the blood to the lungs for oxygenation. Once the blood is oxygenated in the lungs, it returns to the left side of the heart to be pumped out to the rest of the body. Question 74. Visual acuity is. Here are the options. Option A, pressure in the eyeball. Option B, nearsightedness. Option C, sharpness or clarity of vision. Option D, farsightedness. The correct answer is option C, sharpness or clarity of vision. Visual acuity refers to the clarity or sharpness of vision. It is a measure of how well an individual can see fine details and distinguish objects at a distance. A person with good visual acuity has clear vision, while those with poor visual acuity may experience blurred or fuzzy vision. This term is commonly used in optometry to assess and diagnose various vision problems, such as nearsightedness and farsightedness. It is an important factor in determining the overall quality of a person's vision. Question 75. PHI stands for here are the options. Option A. Protected health instructions. Option B. Protected health information. Option C. Private health information. Option D. Private health instructions. The correct answer is option B. Protected health information. PHI stands for Protected Health Information. This term refers to any personal health information that is collected, stored, transmitted, or shared by healthcare providers. This includes any information that can identify an individual, such as their name, address, social security number, or medical history. The term protected emphasizes the importance of keeping this information confidential and secure, in compliance with privacy regulations like HIPAA. Question 76. First order of draw. Here are the options. Option A. Sodium citrate tubes light blue. Option B. Oxalate/fluoride tubes gray. Option C. Heparin tubes green. Option D. Blood cultures yellow. The correct answer is option D. Blood cultures yellow. The correct answer is blood cultures yellow because the question is asking for the first order of draw, which refers to the order in which different types of tubes should be filled with blood during venipuncture. According to the given information, the first tube to be drawn is the one for blood cultures, which is represented by the yellow color. This is followed by the sodium citrate tubes LT, blue, and then the oxalate/fluoride tubes gray. Question 77. To prevent the insured from receiving a duplicate payment for losses under more than one insurance policy is called. Here are the options. Option A. Coordination of benefits. Option B. Fee for service. Option C. Hospital benefits. Option D. Non-duplication benefits. The correct answer is option A. Coordination of benefits. Coordination of benefits refers to the process of preventing the insured from receiving duplicate payments for losses covered by multiple insurance policies. It ensures that the total amount paid to the insured does not exceed the actual expenses incurred. By coordinating benefits, insurance companies can determine the primary and secondary coverage for a claim, avoiding overpayment and reducing fraud or abuse. This process helps to streamline claims handling and promotes fair and efficient distribution of benefits among multiple insurers. Question 78. What is the initial negative deflection produced by ventricular polarization? Here are the options. Option A. R wave. Option B. S wave. Option C. T wave. Option D. Q wave. The correct answer is option D. Q wave. The Q wave represents the initial negative deflection produced by ventricular polarization. It is typically seen in leads that view the septum of the heart. such as leads V1 and V2. The Q wave is considered abnormal if it is wider and deeper than normal, which may indicate a previous myocardial infarction or other cardiac pathology. Question 79. The precaution used in an active TB case is airborne precaution and consists of using here are the options. Option A. Gown, gloves, and face mask. Option B. N95 respirator. Option C. Gloves and face mask. Option D. Standard PPEs. The correct answer is option B. N95 respirator. The correct answer is N95 respirator. An N95 respirator is used as a precaution in an active TB case because it provides a high level of filtration to prevent the transmission of airborne particles, including the TB bacteria. It is designed to fit tightly on the face and filter out at least 95% of airborne particles. This precaution is necessary to protect healthcare workers and other individuals from inhaling the TB bacteria and becoming infected. Question 80. Second order of draw. Here are the options. Option A. Serum or non-additive tube red or red/gray. Option B. Ed tubes lavender. Option C. Sodium citrate tubes light blue. Option D. Heparin tubes green. The correct answer is option C. Sodium citrate tubes light blue. Sodium citrate tubes are used for coagulation studies and are commonly referred to as LT. Blue tubes due to their light blue color. These tubes contain a buffered solution of sodium citrate, which acts as an anticoagulant by binding to calcium ions and preventing blood from clotting. This allows for accurate testing of clotting factors and other coagulation parameters. Question 81. An atomic term meaning toward the back of the body, also called dorsal. Here are the options. Option A. Posterior. Option B. Anterior. Option C. Superior. Option D. Inferior. The correct answer is option A. Posterior. The anatomic term posterior refers to the direction or location towards the back of the body. It is also known as dorsal. Question 82. Ethical standards are. Here are the options. Option A. Laws. Option B. Moral principles. Option C. Regulations. Option D. Traditions. The correct answer is option B. Moral principles. Ethical standards are the moral principles that guide our behavior and decision-making, forming the foundation for what we consider right and wrong, unlike laws, regulations, traditions, or virtues, which may be related but don't define those core principles. Question 83. The pattern of breathing. It can vary with age. Infants have an irregular rhythm while adults have regular. Here are the options. Option A. Pulse rate. Option B. Breathing depth. Option C. Respiratory rhythm. Option D. Pulse rhythm. The correct answer is option C. Respiratory rhythm. The correct answer is respiratory rhythm. The explanation for this answer is that the pattern of breathing refers to the regularity or irregularity of the breaths taken. In infants, the pattern of breathing is often irregular, while in adults it tends to be more regular. This is due to the differences in lung development and the control of the respiratory muscles. Therefore, the respiratory rhythm is a more accurate term to describe the pattern of breathing in different age groups.
Question 84.
The amount of money paid to keep an insurance policy in force is here are the options. Option A,
Deductible.
Option B, copay. Option C,
coinsurance.
Option D,
Premium. The correct answer is option D, premium.
The amount of money paid to keep an insurance policy in force is known as the premium.
This is the regular payment made by the policyholder to the insurance company to maintain coverage.
The premium amount is determined based on various factors such as the type of insurance, the level of coverage, the policyholder's age, and any associated risks. It is important to pay the premium on time to ensure that the insurance policy remains active and provides the desired coverage.
Question 85.
An instrument that measures the air taken in and expelled from the lungs. Here are the options. Option A, spirometer. Option B,
Stethoscope.
Option C,
Sphygmomanometer.
Option D, ophthalmoscope.
The correct answer is option A,
spirometer. A spirometer is an instrument used to measure the volume of air that is inhaled and exhaled by the lungs. It is commonly used in medical settings to assess lung function and diagnose respiratory conditions such as asthma and chronic obstructive pulmonary disease (COPD). By measuring the amount of air a person can inhale and exhale, a spirometer can provide valuable information about lung capacity, airflow, and overall respiratory health.
Question 86.
An anatomic term meaning above or closer to the head, also called cranial. Here are the options. Option A,
inferior.
Option B,
Medial.
Option C,
Superior.
Option D, lateral.
The correct answer is option C,
superior. The term superior is an anatomic term used to describe a location that is above or closer to the head.
It is also referred to as cranial.
This term is commonly used in medical and anatomical contexts to describe the position of structures in relation to each other. Question 87.
Which of the following blood pressure readings would be considered hypertensive according to the American Heart Association guidelines?
Here are the options. Option A, 1 in 10/70 mmHg. Option B, 1/850/95 mmHg. Option C, 1 in 20/80 mmHg. Option D, 1 in 30/85 mmHg.
The correct answer is option B,
1/850/95 mmHg.
A blood pressure reading of 150/95 mmHg is considered hypertensive according to the American Heart Association guidelines.
Hypertension, or high blood pressure, is typically defined as a systolic reading of 130 mmHg or higher, or a diastolic reading of 80 mmHg or higher.
The other options, such as 110/70 mmHg, 120/80 mmHg, and 130/85 mmHg, are either normal or fall within the elevated or stage 1 hypertension ranges. but not as high as the stage 2 hypertension indicated by 150/95 mmHg. Question 88.
Which standard size letterhead is appropriate for most business correspondence? Here are the options. Option A, 51/2x 81/2 inches. Option B, 71/4x 10/2 inches. Option C, 17x 22 inches. Option D, 81/2x 11 inches.
The correct answer is option D,
81/2x 11 inches. The standard size letterhead that is appropriate for most business correspondence is 81/2x 11 inches. This size is commonly used and accepted in the business world. It provides enough space for the content of the letter while still being easy to handle and fit into standard envelopes. The other options listed are either too small or too large for typical business correspondence.
Question 89.
Line between two waveforms. Here are the options. Option A,
Segment.
Option B,
Complex.
Option C, interval. Option D,
Waveform. The correct answer is option A,
segment. The term segment refers to a distinct and separate part or section of something. In the context of the question, it suggests that there is a clear and defined separation between the two waveforms. This implies that each waveform is independent and does not overlap or blend with the other. Therefore, segment is the most suitable term to describe the line between the two waveforms.
Question 90.
A patient who weighs 45 kg also weighs how many pounds? Here are the options. Option A,
45.
Option B,
105.
Option C,
145.
Option D,
99. The correct answer is option D,
99. The correct answer is 99 because 1 kilogram is equal to approximately 2.20462 pounds.
Therefore, to convert the weight from kilograms to pounds, we multiply 45 by 2.20462, which gives us approximately 99 pounds. Question 91.
Fourth order of drawer. Here are the options. Option A, serum or non-additive tube red or red/gray. Option B, heparin tubes green. Option C, tubes lavender. Option D,
Sodium citrate tubes light blue. The correct answer is option B,
heparin tubes green. The correct answer is heparin tubes green because in the fourth order of drawer, heparin tubes are used first. Heparin is an anticoagulant that prevents blood from clotting by inhibiting the action of thrombin. This is important in order to obtain a plasma sample for certain tests. By using heparin tubes first, the risk of contamination from other additives or anticoagulants in subsequent tubes is minimized.
Question 92.
Which position is used for a rectal examination? Here are the options. Option A, Preelon. Option B,
Drennelenburg.
Option C,
Sims.
Option D,
Fowler's. The correct answer is option C, Sims.
Sims position is used for rectal examination. In this position, the patient lies on their left side with the left leg straight and the right leg flexed at the hip and knee.
This position allows for better access to the rectum and facilitates the insertion of a gloved finger or an instrument for examination. Question 93.
A patient lying flat on the abdomen is in the. Here are the options. Option A, prone position. Option B,
Dorsal position.
Option C, lithotomy position. Option D, supine position.
The correct answer is option A,
prone position.
The correct answer is prone position.
In the prone position, the patient is lying flat on their abdomen with their face down. This position is commonly used for procedures or examinations involving the back or spine.
It allows for better access to the posterior aspect of the body and is often used for surgeries or interventions that require access to the back. Question 94.
A difficulty or inability to breathe unless in an upright position. Here are the options. Option A,
Cheyne-Stokes.
Option B,
Orthopnea.
Option C,
Apnea.
Option D,
Dyspnea. The correct answer is option B,
orthopnea. Orthopnea is a condition characterized by difficulty or inability to breathe unless in an upright position. This means that individuals with orthopnea struggle to breathe when lying down and find relief only when they are in a sitting or standing position. Cheyne-Stokes is a pattern of breathing characterized by alternating periods of deep, rapid breathing followed by shallow, slow breathing. Allopnea is not a recognized medical term.
Question 95. The federal and state-sponsored health insurance program for the medically indigent is called. Here are the options.
Option A,
Medicare.
Option B, Medigap. Option C, Medicaid. Option D,
Medi-Cal. The correct answer is option C,
Medicaid. Medicaid is the correct answer because it is a joint federal and state program that provides health insurance to low-income individuals and families who cannot afford health care. It specifically targets the medically indigent population and covers a wide range of medical services, including doctor visits, hospital stays, prescription drugs, and more.
Medicare, on the other hand, is a federal program that provides health insurance to individuals aged 65 and older, as well as certain younger individuals with disabilities. Medigap refers to private insurance plans that help cover the gaps in Medicare coverage, and Medi-Cal is a state-specific program in California that provides healthcare coverage to low-income residents. Question 96.
One who belongs to a group insurance plan is called. Here are the options. Option A, third-party payer. Option B,
Carrier.
Option C, none of the above. Option D, subscriber.
The correct answer is option D,
subscriber. A person who belongs to a group insurance plan is referred to as a subscriber. This individual is typically the policyholder or the primary member of the group plan.
The subscriber is responsible for enrolling in the insurance plan and paying the premiums on behalf of themselves and any dependents included in the coverage.
Question 97. What part of the heart receives the deoxygenated blood from the body? Here are the options. Option A, RT atrium. Option B,
LT atrium.
Option C, RT ventricle. Option D, LT ventricle.
The correct answer is option A.
RT atrium. The right atrium receives deoxygenated blood from the body, pumps it to the right ventricle, which then sends it to the lungs for oxygenation. The oxygenated blood returns to the left atrium, is pumped to the left ventricle, and finally, the left ventricle pumps this oxygen-rich blood out to the rest of the body.
Question 98. Holly Hunter.
Here are the options. Option A,
RCD.
Option B,
CFH.
Option C,
HUJM.
Option D,
GMHT. The correct answer is option C. HUJM.
Holly Hunter is filed by the last name Hunter. Hunter begins with Who, which falls in the HUJM draw range.
Question 99. Island Yachts, Inc.
Here are the options. Option A,
RCD.
Option B,
HUJM.
Option C,
CFH.
Option D,
GMHT. The correct answer is option B. HUJM.
Island Yachts, Inc. is filed under Island. Island begins with Is, which falls in the HUJM draw range. Question 100. A claim that is printed and mailed to the carrier is called a blank copy. Here are the options. Option A,
Soft.
Option B,
File.
Option C, paper. Option D,
Hard. The correct answer is option D. Hard.
a claim that is printed and mailed to the carrier is called a hard copy because it refers to a physical document that is tangible and can be held in hand.
Unlike soft copies, which are electronic files stored on a computer or other digital devices, hard copies are typically printed on paper and physically sent or delivered.
In this context, a hard copy would be the most appropriate term to describe the printed and mailed claim document.
Question 101.
The position used in exams where the patient lays on her back with legs extended is here are the options. Option A, horizontal recumbent position. Option B,
Sims.
Option C, recumbent lithotomy. Option D, Perdilan.
The correct answer is option A.
Horizontal recumbent position.
The correct answer is horizontal recumbent position.
This position refers to the patient lying on their back with their legs extended. It is commonly used in exams to allow for a clear view and access to the patient's abdomen and lower extremities.
Question 102.
Which of the following is not true regarding HIPAA laws? Here are the options. Option A, patients have more control over their medical records. Option B, patients can make informed choices regarding how their personal health information is used. Option C,
Violators are held accountable if patient privacy rights are compromised.
Option D, few boundaries are set on the use and release of health records.
The correct answer is option D.
Few boundaries are set on the use and release of health records. HIPAA laws actually set strict boundaries on the use and release of health records. These laws ensure that patients have more control over their medical records and can make informed choices regarding how their personal health information is used.
Violators of HIPAA laws are held accountable if patient privacy rights are compromised.
Therefore, The statement few boundaries are set on the use and release of health records is not true.
Question 103.
The least reliable measurement of body temperature is blank. Here are the options. Option A,
Rectal.
Option B,
Axillary.
Option C, oral. Option D, all are equally reliable.
The correct answer is option B, axillary.
The axillary measurement of body temperature is considered the least reliable because it tends to be less accurate than other methods. This is because the axillary temperature is measured in the armpit, which is further away from the body's core and can be affected by external factors such as clothing and ambient temperature. Rectal and oral measurements are generally more accurate as they are closer to the body's core temperature.
Question 104. Find the correct place for the following names so that it will be in alphabetical order with the others white. Samantha or blank Fars, Shirley B. blank Volper, Eric C. blank Waite, Amanda D. blank Wright, C.J. E. blank.
Here are the options. Option A, Option A, Option B, Option B, Option C, Option D, Option D, Option C.
The correct answer is option C.
Option D. To correctly place White, Samantha in alphabetical order among the given names, we compare it with each name. White Samantha follows Waite, Amanda, and comes before Wright, C.J. Because White alphabetically falls between Waite and Wright. Therefore, the correct position for White, Samantha, is between Waite, Amanda, and Wright, C.J. This placement ensures that the list remains in proper alphabetical order.
Question 105. For each item, indicate which filing cabinet drawer from that set would be used by selecting the appropriate letter. Dan Cedar.
Here are the options. Option A, RCH. Option B, CIDH. Option C, DIFL. Option D,
FM and HT. The correct answer is option A,
RCH. Dan Cedar is filed by the last name Cedar. Cedar begins with C, which falls within the RCH draw range.
Question 106.
Refers to the movement away from the isoelectric line in an EKG. Here are the options. Option A,
segment.
Option B,
waveform.
Option C, interval. Option D,
complex. The correct answer is option B, waveform. The correct answer is waveform because when referring to an EKG, a waveform represents the graphical representation of the electrical activity of the heart.
It shows the changes in voltage over time, including the depolarization and repolarization of the heart muscle.
The movement away from the isoelectric line in an EKG waveform indicates the presence of electrical activity and can provide important information about the heart's function and any abnormalities. Question 107.
The myocardial cell's ability to contract in response to a stimulus. Here are the options. Option A, conductivity. Option B,
automaticity.
Option C,
contractility.
Option D,
excitability. The correct answer is option C,
contractility.
Contractility refers to the ability of the myocardial cell to contract in response to a stimulus.
This means that when the cell is stimulated, It is able to generate a forceful contraction, which is essential for the pumping action of the heart. Contractility is a key characteristic of cardiac muscle cells and is regulated by various factors, including the availability of calcium ions and the sensitivity of the contractile proteins.
It is important for maintaining proper cardiac function and is also influenced by external factors such as hormones and neurotransmitters. Question 108.
Who makes the guidelines for isolation precautions? Here are the options. Option A,
CLSI.
Option B,
OSHA.
Option C,
FDA.
Option D,
CDC. The correct answer is option D, CDC.
The Centers for Disease Control and Prevention (CDC) is responsible for making the guidelines for isolation precautions. The CDC is a federal agency that focuses on protecting public health and preventing the spread of diseases.
They provide evidence-based recommendations and guidelines for healthcare professionals to follow in order to prevent the transmission of infectious diseases in healthcare settings. These guidelines include recommendations for isolation precautions, such as the use of personal protective equipment and the implementation of specific infection control measures. Question 109.
Information that is gained by questioning the patient or taken from a form is called blank information. Here are the options. Option A,
Subjective.
Option B,
Confidential.
Option C,
Objective.
Option D,
Necessary. The correct answer is option A,
subjective. Subjective information in a medical context is gathered directly from the patient, either through conversations where they describe their symptoms, feelings, and medical history, or through forms they complete. This type of information is valuable because it provides the patient's perspective on their health, but it's subjective because it's based on their personal interpretation, not necessarily on verifiable facts. This contrasts with objective information, which is gathered through observations, examinations, and tests, providing measurable and verifiable data.
Question 110.
The destruction of all microbial life, pathogen, and non-pathogens are destroyed by, here are the options. Option A, medical asepsis. Option B, hand washing. Option C, sterilization. Option D, standard precautions.
The correct answer is option C,
sterilization. Sterilization is the only process that eliminates all microbial life, including both harmful pathogens and harmless non-pathogens, using methods like high heat and chemicals to achieve complete destruction. In contrast, medical asepsis, hand washing, and standard precautions aim to reduce microbial spread but don't guarantee total eradication.
Question 111.
An atomic term that refers to the plane that divides the body into superior and inferior portions. Here are the options. Option A,
Sagittal plane.
Option B, transverse plane. Option C, frontal plane. Option D,
Median plane. The correct answer is option B,
transverse plane. The anatomic term transverse refers to the plane that divides the body into superior and inferior portions.
This means that the transverse plane cuts the body horizontally, separating the upper superior part from the lower inferior part.
It is commonly used in medical and anatomical contexts to describe the orientation and position of structures within the body. Question 112. Who is the legal owner of the patient's medical record? Here are the options. Option A,
The patient.
Option B,
The patient's insurance company.
Option C, both the patient and the physician. Option D,
The physician or agency where services were provided. The correct answer is option D. The physician or agency where services were provided. The correct answer is the physician or agency where services were provided.
This is because the medical record is created and maintained by the healthcare provider or agency that provides the services to the patient.
They are responsible for keeping the record accurate, confidential, and accessible to the patient when needed,
while the patient has the right to access and request copies of their medical records. The ownership of the physical record itself typically lies with the healthcare provider. Question 13. Medical asepsis is blank. Here are the options. Option A, destruction of pathogens on medical equipment. Option B, destruction of pathogens on the skin before a venipuncture procedure. Option C, the prevention of germs on the hands of healthcare workers. Option D, none of these four.
The correct answer is option A.
Destruction of pathogens on medical equipment. Medical asepsis refers to the practice of eliminating or destroying pathogens on medical equipment.
This is essential to prevent the transmission of infections in healthcare settings. By thoroughly cleaning and disinfecting medical equipment, healthcare professionals can ensure that it is free from harmful microorganisms that could potentially cause harm to patients.
This is an important aspect of infection control and plays a crucial role in maintaining a safe and sterile healthcare environment.
Question 114.
Find the correct position for the name Robertson, Jan, so that it will be in alphabetical order with the others. Here are the options. Option A, before Roberts, J. Option B, between Roberts, J and Robertson, James. Option C, between Robertson, Jane and Robertson, Janice. Option D, between Robertson, James and Robertson, Jane.
The correct answer is option D.
Between Robertson, James and Robertson, Jane. When alphabetizing, names are compared letter by letter. Robertson, Jan comes after Robertson, James because M comes before N, and before Robertson, Jane because shorter names take precedence when the beginning letters are identical. Therefore, the correct placement is between Robertson, James and Robertson, Jane.
Question 15.
Fredericks, Dunley and Crane, attorneys at law. Here are the options. Option A, RCH. Option B,
FMHT.
Option C, PSI-DH. Option D, DIFL.
The correct answer is option B, FMHT.
Fredericks, Dunley and Crane is filed under Fredericks. Fredericks begins with FR, which falls within the FMHT draw range.
Question 116.
A test used to measure breathing capacity. Here are the options. Option A,
audiometry.
Option B, tonometry. Option C, spirometry. Option D, Electrocardiography.
The correct answer is option C.
Spirometry. Spirometry is a test used to measure breathing capacity. It is a diagnostic tool that measures the volume of air inhaled and exhaled by the lungs.
It provides important information about lung function and can help diagnose conditions such as asthma, chronic obstructive pulmonary disease (COPD), and other respiratory disorders.
Spirometry is performed by having the individual breathe into a device called a spirometer, which measures the airflow and produces a graphical representation of the lung function. This test is widely used in clinical settings to assess and monitor lung health. Question 117. If the brachial artery is positioned much above the heart while taking blood pressure reading, it will cause the blood pressure to appear falsely blank. Here are the options. Option A,
Low.
option B,
High.
option C,
No change.
option D,
Erratic. The correct answer is option A.
low. If the brachial artery is positioned much above the heart while taking a blood pressure reading, it will cause the blood pressure to appear falsely low.
This is because the height difference between the artery and the heart creates a gravitational effect, leading to decreased blood flow and pressure in the artery. As a result, the blood pressure reading will be lower than the actual pressure in the arteries. Question 118.
A regular pattern of irregular breathing rate. Here are the options. Option A, orthopnea. Option B,
Cheyne-Stokes.
option C,
Apnea.
option D, bradypnea.
The correct answer is option B. Cheyne-Stokes.
Cheyne-Stokes is a regular pattern of irregular breathing rate characterized by alternating periods of deep, rapid breathing followed by shallow, slow breathing or temporary cessation of breathing. This pattern is often seen in individuals with heart failure, brain damage, or respiratory disorders. Orthopnea refers to difficulty breathing while lying flat, and allopnea refers to the absence of breathing. However, neither of these terms describes the specific regular pattern of irregular breathing rates seen in Cheyne-Stokes. Question 119. The normal range for an axillary temperature is here are the options. Option A, 98.6-99.6. Option B, 97.6-99.6. Option C, 96.6-98.6. Option D, 99.6-109.6.
The correct answer is option C.
96.6-98.6. The normal range for an axillary temperature is 96.6-98.6. This range is considered normal because it falls within the average body temperature range for most individuals, which is around 97-99 degrees Fahrenheit.
Axillary temperature is measured in the armpit and is typically slightly lower than oral or rectal temperature readings.
Therefore, a range of 96.6-98.6 is considered normal for axillary temperature.
Question 120.
Which is not a link in the chain of infection. Here are the options. Option A,
Host.
option B,
Agent.
option C, portal of exit, Option D. Mode of transportation.
The correct answer is option D.
Mode of transportation. The mode of transportation is not a link in the chain of infection because it refers to the method by which a pathogen moves from one host to another rather than a specific component of the chain. The chain of infection consists of a series of interconnected links, including the host, the individual who can become infected, the agent, the pathogen causing the infection, and the portal of exit, the route through which the pathogen leaves the host's body. These elements contribute to the spread of infection, while the mode of transportation simply describes how the pathogen is transmitted.
Question 121.
A patient in the Sims position is lying on the. Here are the options. Option A. Left side and chest, with right leg flexed. Option B.
Right side with left leg flexed.
Option C.
Back with both legs bent.
Option D. Right side with right leg flexed.
The correct answer is option A.
Left side and chest, with right leg flexed.
The correct answer is left side and chest, with right leg flexed.
The Sims position is a commonly used position in medical settings for procedures such as rectal examinations and enemas. In this position, the patient lies on their left side with the right knee and thigh flexed towards the chest.
This position allows for better access and visibility of the rectal area.
Question 122. A combination of universal precautions and body substance isolation guidelines used in hospital for the care of all patients. Here are the options. Option A. Airborne precautions. Option B. Contact precautions. Option C. Standard precautions. Option D. Droplet precautions.
The correct answer is option C.
Standard precautions. Standard precautions are a set of infection control practices that are used in healthcare settings to prevent the transmission of infectious diseases. These precautions include hand hygiene, the use of personal protective equipment such as gloves and masks, safe handling and disposal of sharps, and proper cleaning and disinfection of equipment and surfaces. Standard precautions are used for the care of all patients, regardless of their presumed infection status, and are designed to protect both healthcare workers and patients from the spread of pathogens. Question 123. The insertion of a needle or cannula small tube into a vein for the purpose of withdrawing blood is called. Here are the options. Option A.
Catheterization.
Option B.
Venipuncture.
Option C.
Intubation.
Option D.
Immunization. The correct answer is option B. Venipuncture. Phlebotomy or venipuncture is the correct answer because it refers to the process of inserting a needle or cannula into a vein in order to withdraw blood.
This procedure is commonly performed for various medical purposes, such as diagnostic testing or blood donation.
Question 124.
This is an infection control method designed to prevent direct contact with blood or other body fluids. Here are the options. Option A.
PP.
Option B. Contact precautions. Option C. Hand washing. Option D. Standard precautions.
The correct answer is option D.
Standard precautions. Standard precautions is an infection control method that aims to prevent direct contact with blood or other body fluids. It includes the use of personal protective equipment (PPE) such as gloves, masks, and gowns to create a barrier between healthcare workers and potentially infectious materials. Standard precautions also emphasize hand hygiene practices, such as regular hand washing, to reduce the transmission of pathogens. By following standard precautions, healthcare professionals can minimize the risk of infection and ensure the safety of both themselves and their patients.
Question 125.
When a patient is lying on her back with her arms above her and her legs extended, she is in what position? Here are the options. Option A,
Horizontal recumbent.
Option B,
Dorsal recumbent.
Option C, dorsal lithotomy. Option D, Predihalon.
The correct answer is option A, horizontal recumbent. The correct answer is horizontal recumbent.
In this position, the patient is lying on their back with their arms above their head and their legs extended. This position is often used for medical examinations or procedures that require easy access to the patient's chest and abdomen.
It allows for comfortable and relaxed position for the patient while providing the healthcare provider with optimal access to the patient's body. Question 126. The process of returning to the original polar resting state.
Here are the options. Option A,
depolarization.
Option B, polarization. Option C,
defibrillation.
Option D, repolarization.
The correct answer is option D,
repolarization.
Repolarization refers to the process of returning to the original polar resting state.
This occurs after depolarization, which is the initial change in the electrical charge of a cell.
During repolarization, the cell's membrane potential is restored to its resting state, allowing it to be ready for the next electrical impulse or action potential. This process is essential for the proper functioning of cells, especially in the nervous system and in cardiac muscle cells.
Question 127. Find the correct place for the following name so that it will be in alphabetical order with the others. Andrew C, Alan blank Andrew, Adam B blank Andrew C, C blank Andrew, Carrie D blank Andrew, Cassie E blank. Here are the options. Option A, Option A, Option B, Option B, Option C, Option C, Option D, Option D.
The correct answer is option B.
Option B. To insert Andrew C. Ellen into the list in alphabetical order, compare the given names after the surname Andrew. The source places it in position B after Andrew, Adam and before Andrew C.
Question 128. Verified checks.
Here are the options. Option A, RCH. Option B,
NG no.
Option C,
SNWD.
Option D, NPSM.
The correct answer is option C, SNWD.
Verified checks is filed under verified. Verified begins with V, which falls within the SNWD draw range.
Question 129.
The non-profit organization that assists healthcare facilities by providing accreditation. Here are the options. Option A,
JCAHO.
Option B,
OSHA.
Option C,
ABHES.
Option D,
JKO. The correct answer is option A.
JCAHO. JCAHO, also known as the Joint Commission on Accreditation of Healthcare Organizations, is a non-profit organization that provides accreditation to healthcare facilities. They assist these facilities by evaluating and ensuring that they meet certain quality and safety standards. JCAHO accreditation is highly regarded and signifies that a healthcare facility has met rigorous requirements in areas such as patient care, safety, and organization management.
This accreditation can help healthcare facilities improve their overall performance and enhance patient trust and confidence in their services. Question 130.
A sum of money provided in an insurance policy, payable for covered services, is called. Here are the options. Option A,
Deductible.
Option B,
Benefits.
Option C, dues payable. Option D,
Premium. The correct answer is option B.
benefits.
In an insurance policy, benefits refer to the sum of money provided for covered services. This is the amount that the policyholder will receive from the insurance company when they make a claim for a covered service. The benefits can vary depending on the type of insurance policy and the coverage provided. It is important to understand the benefits of an insurance policy to know what services are covered and the amount of money that will be reimbursed. Question 131.
A fluctuating fever that remains elevated. It does not return to baseline temperature. Here are the options. Option A,
Constant.
Option B,
Intermittent.
Option C,
Remittent.
Option D,
Relapsing. The correct answer is option C. Remittent.
Remittent is the correct answer because it describes a fluctuating fever that remains elevated and does not return to baseline temperature. This means that the fever may go up and down, but it never fully goes away. Constant would imply that the fever remains at a steady elevated temperature without any fluctuations. Intermittent would suggest that the fever comes and goes, returning to a normal temperature in between episodes.
Question 132.
Generally, a referral letter has a lifespan of 12 months. This lifespan starts on the day the letter is written. Here are the options. Option A,
False.
Option B,
True. The correct answer is option A. False.
a referral letter is valid from the day it is written, but its lifespan starts from the first consultation with the specialist. For example, letter written on 1st June 2012 and valid from this date. Date of the first appointment with a specialist is 1st Sep 2012. Therefore, the lifespan of the referral starts on this date, and referral will run out on 31st August 2013.
Question 133. Blank. Blood pressure measured when the heart contracts and ejects blood into the aorta from the left ventricle.
Here are the options. Option A, diastolic. Option B,
Pulse.
Option C,
Orthostatic.
Option D,
Systolic. The correct answer is option D.
systolic.
Systolic blood pressure is the pressure in the arteries when the heart's left ventricle contracts and pumps blood into the aorta.
It is the higher of the two numbers in a blood pressure reading, e.g. 120/80 mmHg, where 120 represents the systolic pressure. The systolic pressure reflects the force exerted on the artery walls during heartbeats.
Question 34.
An anatomical term that refers to the plane that divides the body into left and right portions. Here are the options. Option A, transverse plane. Option B, frontal plane. Option C,
Sagittal plane.
Option D, coronal plane.
The correct answer is option C,
Sagittal plane. The anatomical term that refers to the plane dividing the body into left and right portions is called the sagittal plane. The sagittal plane runs longitudinally and divides the body into two symmetrical halves, with one side being the mirror image of the other. It is often used in medical and anatomical descriptions to indicate positions and structures on the left and right sides of the body. Question 35. Which is not a common symptom of shock? Here are the options. Option A,
clammy skin.
Option B,
Excessive sweating.
Option C,
Expressionless face.
Option D, rapid pulse.
The correct answer is option B, excessive sweating. Excessive sweating is not a common symptom of shock.
Shock is a life-threatening condition where the body's organs and tissues do not receive enough oxygen and nutrients. Common symptoms of shock include clammy skin, an expressionless face, and a rapid pulse. These symptoms occur due to the body's response to low blood pressure and reduced blood flow. However, excessive sweating is not typically associated with shock. Instead, it is more commonly seen in conditions such as hyperhidrosis or during physical exertion. Question 136. Sterile wrapped items can be safely stored and considered sterile for up to. Here are the options. Option A, 7 to 14 days. Option B, 14 to 21 days. Option C, 21 to 28 days. Option D, 28 to 30 days.
The correct answer is option D,
28 to 30 days. Sterile wrapped items can be safely stored for a period of 28 to 30 days. This means that the items have been properly packaged and sealed to prevent contamination, and they can maintain their sterility for the specific time frame. After this period, the sterility of the items may no longer be guaranteed, and they may need to be re-sterilized before use. Question 137. How many provisions does HIPAA contain? Here are the options. Option A,
3.
Option B, 1. Option C, 2. Option D,
4. The correct answer is option A,
D. HIPAA is commonly taught as containing three major provisions of portability, tax-related provisions, and administrative simplification. Therefore, the correct answer is 3.
Question 138.
How would you properly index the name Amanda M. Styles Duncan for filing? Here are the options. Option A, Styles Duncan, Amanda M. Option B,
Duncan Styles, Amanda M.
Option C, Duncan, Amanda M.
Styles.
Option D, Styles Duncan, Amanda M.
The correct answer is option D,
Styles Duncan, Amanda M. The correct answer is Styles Duncan, Amanda M. This is the correct way to index the name Amanda M. Styles Duncan for filing because it follows the standard practice of alphabetizing surnames first, followed by the given name. The hyphen in the name is ignored for filing purposes.
Question 39. The sinoatrial node is often referred to as the body's natural blank.
Here are the options. Option A,
Valve.
Option B,
Pacemaker.
Option C,
Conductor.
Option D,
Septum. The correct answer is option B,
pacemaker.
The sinoatrial SA node is a small cluster of specialized cells located in the right atrium of the heart. It is responsible for initiating the electrical impulses that regulate the heartbeat. The SA node generates electrical signals at a regular rate, which spread through the heart muscle, causing it to contract and pump blood.
Due to its role in setting the heart's rhythm, the SA node is often called the body's natural pacemaker.
Question 140. What term describes the process of reducing the number of microorganisms on an object or surface to a fairly safe level?
Here are the options. Option A, sterilization. Option B,
Disinfection.
Option C, sanitization. Option D,
Autoclaving. The correct answer is option C,
sanitization.
Sanitization refers to the cleaning process that lowers the number of microorganisms on a surface to a level considered safe by public health standards.
It does not necessarily eliminate all microorganisms but reduces them to a level that minimizes the risk of spreading infection. This process is commonly used in environments like kitchens, hospitals, and other settings where hygiene is critical.
Question 141.
What is the function of the sphygmomanometer in a medical setting? Here are the options. Option A,
Measure blood pressure.
Option B,
Measure temperature.
Option C, measure heart rate. Option D, measure respiratory rate.
The correct answer is option A,
measure blood pressure. A sphygmomanometer is a device used to measure blood pressure. It consists of an inflatable cuff that is wrapped around the upper arm, a pressure gauge, and a stethoscope. The cuff is inflated to constrict blood flow in the arm, and then the pressure is slowly released while the healthcare professional listens with the stethoscope for the sounds of blood flow returning to the artery. This allows them to determine the systolic and diastolic blood pressure readings.
Question 142. Any type of protective gear worn to guard against physical hazards.
Here are the options. Option A, sterile field. Option B, personal protective equipment. Option C,
Biohazard waste.
Option D, standard precautions.
The correct answer is option B,
personal protective equipment. Personal protective equipment (PPE) refers to any type of gear that is worn to protect against physical hazards. This can include items such as helmets, gloves, goggles, masks, and safety clothing.
PPE is essential in various industries and workplaces where there is a risk of injury or exposure to dangerous substances. It acts as a barrier between the wearer and the potential hazards, helping to minimize the risk of accidents or injuries.
PPE is crucial in ensuring the safety and well-being of individuals in hazardous environments.
Question 143.
In a clinical setting, The primary role of a medical assistant during a minor surgical procedure is to maintain blank by ensuring that all instruments and the environment are sterile. Here are the options. Option A,
anesthesia.
Option B,
Ambulation.
Option C,
Asepsis.
Option D,
Auscultation. The correct answer is option C, asepsis.
Maintaining asepsis is crucial during any surgical procedure to prevent infection. The medical assistant plays a vital role in ensuring that all instruments, surfaces, and their own hands are properly sterilized and that the sterile field is not compromised, thus protecting the patient from potential contamination.
Question 144.
Under the skin. Here are the options. Option A,
Intramuscular.
Option B, intravenous. Option C,
Intradermal.
Option D,
Subcutaneous. The correct answer is option D, subcutaneous. The term subcutaneous refers to something that is located or occurring beneath the skin. Therefore, subcutaneous is the correct answer because it directly relates to the phrase under the skin.